Hi everybody, my name is Missy Chamberlain, MD. I'm a retired orthopedic surgeon. I feel as helpless as all of you do to try to help my family, to try to help my friends. The suffering in humanity is just devastating. And I now have COVID-19, so I'm not sure how things are gonna go. So I decided, you can call me Dr. Missy, that we're going to do medical school here, and I'm going to teach you as much as I know about how you can help yourself. Honestly, I'm in day 10. I feel way better than I did on day 5, and I think this is what made the difference. So here we go. My shirt I have sacrificed for you. Right here, this is the rib cage, the black line. Okay? It goes all the way around to the back, rib cage. The little black spots are the little air sacs. When we breathe the air in through the tubes in our lungs, they go all the way to the air sacs, and they have to be filled. The oxygen there then transfers that oxygen into the blood, and then that feeds us. It feeds our brain, it feeds everything. Without that, we suffocate. We suffocate. People are suffocating, in my opinion. I'm an orthopedic surgeon. I'll give you a little bit of background. I went to Columbia Engineering. I finished there in 1984. A little older, whatever. 88, I finished Emory Medical School in Atlanta, Georgia. 94, I finished my orthopedic surgery training. I spent the last 25 years in Gunnison and Crested Butte, Colorado, which is another epicenter of this virus, probably because seasonally, many people from around the world love Crested Butte for skiing and any other ski resort. So you're seeing a major epicenters in ski resorts, for one. Anyway, when we breathe in, we breathe the air in on the left side by heading towards the heart. The main tube goes very horizontal. On the right side, it goes quite vertical into the lung. The lung is the green, okay? I know it looks like my boob, but it's the green. And then those big red tubes, see the air is the black arrows, goes all the way through these little branches, like, you know, like a tree branch, all the way to the alveoli, which are the little air pockets. Well, those air pockets are taking the oxygen that you breathed in, and they're transferring it to blood that doesn't have oxygen in it, that you've already used, and they're putting it in to the blood to get good oxygen out there so you can breathe well, so your heart's working well, so your brain's working well, so everything's working well, okay? These, you know, COVID goes in your, it goes in your mouth, usually by your hands. Don't touch your face. I'm gonna try not to do that in this video so you don't, I'm trying. It's a hard thing not to touch your face. But anyway, I did just wash my hands, and I'm not, you breathe in, you get some COVID in your mouth, in your lungs. And that COVID, doesn't it look like a piece of Velcro? It makes sense that it would want to really attach in here. Well, if you look microscopically at what this looks like, this is actually globular cells, a blob, and hair. And the hair moves debris out. It tries to move it back out. You know how when you cough up a loogie or whatever, the hair moves it out. Well, the COVID is like a piece of Velcro, in my mind. It can't move it out. So it keeps going in, keeps going in. Well, the globular cells, these guys, right next to the hair, goes, whoa, 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 there's a lot of debris in here. There's a lot of COVID-19 in here, and it produces mucus, gobs of mucus in bad cases. Most of you are gonna do fine. You're gonna have a dry cough. I'm not talking about a dry cough here. I'm talking about this. Do you hear how that sounds so junky? That's not a dry cough. A dry cough is more, I don't know. Anyway, I'm not trying to make fun of anything. So anyway, the mucus builds up in here, the COVID builds up in here. You can get major pneumonias major fluid backs up, and basically it's like drowning in your own water. You suffocate. So I'm giving you some ideas. I started this on day 2 when I realized my breathing was kind of like this. And I was going, oh my gosh, I'm getting shortness of breath. I'm supposed to go in now. And I'm like, I'm not going in. I don't want to use the healthcare system. I want other people to use it. I'm fine. Anyway, when I trained at Grady Memorial Hospital in Atlanta, Georgia I was there from 84 to 94 because I did my medical school and then my orthopedics. So I was there for 10 years after college. In my 3rd and 4th year of medical school, we would start taking call. And as a medical student, they didn't let you do anything to anybody. So they did teach us how to do this technique with cupped hands. It should sound like a drum. You hear it? If you slap flat, it hurts. That's not what you want to do. You want the cup. And really make it ring in the room. I want it to be musical, okay? I write songs on the side. That's what I've been doing for a while to de-stress. And also, mainly to de-stress. Anyway. So this is going to fill with junk. One of the best ways to clear it, when I was a medical school student taking those calls, every hour I would have to go up on the pediatric ICU floor, and I would have to do to all these little boys and girls with cystic fibrosis and other major pulmonary problems to mechanically, manually clear their mucus. Well, if you do that, it will clear the mucus. Now, the main parts you want to do, it's best to have somebody do this for you, is along the side, lower rib cage, and along the back rib cage. And I've got another video that shows that, so I'm sorry I can't explain that to you, but go to the other one. Dr. Missy, Medical School for COVID-19. Anyway, when you do that, it just starts making you cough like crazy. If they get to this one spot and you start coughing, don't let them move. That means there's crap in there. And just, let the person have a coughing fit. Let them catch their breath a little. Sometimes it gets you out of breath to have a coughing fit, you can imagine. Anyway, let them do that until you quit coughing. Now, the way to breathe to make sure that these little air sacs are opening up is to breathe through like a mouth, like pretend like you had a straw in your mouth. Okay, really small hole. Oh, I just touched my mouth. See? It's so easy to do. Anyway, I did just wash my hands, I promise, and we've been quarantined here for 2 weeks already. I'm on day 10. Anyway, I am way better. Don't worry about me. So the breathing you're going to do while that other person helps you, and actually you can do this breathing all day long when you're watching TV, when you're reading, when you're laying in bed just before you go to sleep. If you're laying down, do it this way. See how this goes this way? Well, don't you think if I laid straight on my side, that whole lung would have a better chance of draining? So when you're in bed and you lay on your right side, your left lung drains beautifully. And just do this breathing, which is not. Instead, you breathe out. And when you breathe in, very slowly through a small mouth. It'll make you cough because it's trying to open up those sacs and they're filled with muck, and so that's good. What I do is I have to have 10 breaths through that small lip on my side for me to, without coughing, you know, I go through my coughing fit and then I finally quit coughing, then I know this lung is pretty well cleared. I've done that myself. On this side, look, it's more of an angle. So you actually want to do what's called postural drainage. So you want to kind of lean over this way. You kind of want to get that as vertical as you can, if that makes sense. So not just flat on the bed, but put something underneath yourself. You are laying on your left-hand side, but you're going to put something underneath your hips to bring this line here more easy for gravity to work on. Then you can do the same thing over here. This is when you're doing your own breathing, just like this. Oh, wait. Oh, God. That feels good, though. Because after you clear it, I know it's kind of uncomfortable to clear it, and it sounds disgusting, and I'm very sorry. I am really just trying to help here. If anybody puts bad press, or, you know, like, hey, I don't like your hair, and I don't like your tattoo, and I don't, you know, just go away. I don't think there's any of you out there that are left, but I could be wrong. I pray I'm not wrong. Anyway, so I do both of those before I go to sleep. If I find I can't clear one lung, I wake my husband up. If you don't have that, and certainly from the very get-go, if you have any major shortness of breath and this is not working for you, please go see somebody. You've got to call your doctor. They'll direct you to the emergency room that's available. You know, you probably need more help than what you can do for yourself. This is intended for people before they get to that point. Now, the other video shows Phil actually doing, I can't make the right sound, you know, twist it around like that, but anyway, once these clear, your fever's going to go away. You're not going to get a pneumonia. You're not going to have to go in the hospital. You're not going to need a ventilator, and you're not going to die. I'm not guaranteeing this is a cure. This is actually not killing the virus. This is the cause of everything is the virus. I understand that. But the effect is people are drowning in this mucus as their body's trying to eliminate this foreign body, this virus. And I mean, what happens when you drown? You die. And so many people are dying, and I'm devastated like you are. So please work on your lungs, okay? Go to that other video. This is Dr. Missy. We're gonna do a hand washing one. I'm gonna show you how to put a mask on properly. I got a feeling at some point they're gonna want us to start using some masks. I could be wrong. There are proper and improper ways to put those on and wear them. And I've already made a video regarding the percussion technique. And the way you do that, and it explains in the video, is you wanting to get the lower rib cage. Lower rib cage around the front. Guys, it's going to be a little easier for you. We've got this other stuff in the way. And then all around, and especially right here. See right there? Especially the lower rib cage, right there. Now, if that's pretty clear, you know, have them do up here too. Have them do on the upper and the middle part of your back too. Go everywhere. Some of you have very sick family members. You can teach a child how to do this. I remember teaching children how to do it for their brother. If you have a child that has this problem and, you know, you're trying to help, but they're not short of breath yet, but you kind of hear the cough, instead of using a cupped hand like this, you're going to use 3 fingers, and you're going to put that middle finger up a little so it actually makes a tiny little cup right there. And that's what you use for a child. Put their head down, put their fanny up here, lay them on your arm, put them over your knee if they're a little heavier, but get them in a downward position. Remember, we want this to drain. Downward position, and then start doing this. Same thing. Their lower rib cage, all across their back. They'll cough, they'll cough. They might even turn blue for a few seconds. We got to get the junk out. They're going to end up suffocating, pneumonia, and possibly dying. I know it's not affecting a lot of babies, but I don't think we can rely on the fact that it won't affect any. I love you guys. I've always been a nerd. I was teased a lot for it in high school, as you can imagine. But my goal in life has always been to help hurting people. And this is just beyond imagination how many people across the planet are hurting. So hopefully this helps you. Please get the word out. I'm thinking we might even make COVID t-shirts, but I'm not much of an artist, so that's probably not a good idea. So air goes in, goes down the bronchioles. This one, straight across. That's why when you lay on your right side on a bed, it's got great drainage for the right. This one, not so much. You have to get your hip up, right? Because you want to get this bronchiole up and down with gravity. You know, gravity just acts this way. Sorry. It just acts up and down. Gravity doesn't really come from the side. So you got to get the right lung more. If this and the bed is here, so you can see that my head is sitting on the bed, but down here I need to put quite a bit of a bolster, a number of pillows, books. I don't care what you use. Do it often. It's made a big difference on us. I have not tested for COVID-19. The lines are so long. My husband went out yesterday to try to see if we could go, and he came back and said, honey, the lines are so long, hours and hours. The other thing, cough. Don't be embarrassed to cough. Don't be, you know, especially like a woman, you don't want to cough those disgusting kind of coughs, but be proud of your disgusting cough right now, okay? Get it gone. If you've got it and no one else in the family has it, you need to be isolated. You can't be having this cough and all this stuff spewing all over your family, your pets, things like that. My husband and I both have it, and we're here alone. We do have pets, and I should probably isolate them, but gosh, I love them too much not to have them with me right now, especially. Anyway, I think I've made sense. I've got no script here. My script is that I want to help you. I really think this will work. It's worked great for us. My name is Missy Chamberlain, Dr. Missy, Medical School for COVID-19. Thanks for watching. Take care of your loved ones.